there was a law written that to allow compounding pharmacies to make compounds that were part of approved drugs. So, part of approved ingredients of approved drugs, to make them individually for patients who did not have access to the particular formulation that they needed to fit them. Maybe if they had an allergy to the commercial brand or whatever. And the compounding pharmacies, and peptides was part of that group. There were 19 peptides that were widely formulated by compounding pharmacies during the Biden administration. They illegally moved those to Category 2, which says do not formulate. It was illegal because they're not supposed to do that unless there's a safety signal. And they didn't have a safety signal. They're not allowed to look at efficacy. They're not allowed to say, well, we don't believe these are efficacious or whatever. They can only look at safety. They moved those to Category 2. What happened? There was huge demand for peptides. And so a black market came out. And the black market is run by companies that say that they're making the peptides for animal use or for research purposes. And that peptide now basically completely replaced the legal market for peptides. We inspect those. So you're getting a good product. You're getting what you bought, what was advertised. With the gray market, you have no idea. And a lot of this stuff that we've looked at is just, is very, very substandard. Oh, I'm very anxious to move about 14 of them back to making them more accessible. And FDA is in the middle of, I think, within a couple of weeks, we will have announced some kind of new action. My hope is that they're going to get moved to a place where people have access from ethical suppliers.
That's ultimately the problem with all this black market stuff, right? A lot of people are getting bogus peptides. And